I mean, long gone are the days where therapists are just dry and uptight or whatever you see on TV. Hello, hello, lovely people. Welcome to my virtual couch. I am so excited to be on this journey with you all. I ask for grace and patience as I navigate these YouTube streets, okay? So, who am I? Harpo, who this? My name is Pamela Atuei. I am a licensed clinical professional counselor and also a licensed clinical drug and alcohol counselor. So, I'm going to be doing a series of topics pertaining to mental health, wellness, lifestyle, et cetera, et cetera. So I'm glad you are along for the ride. Okay, so you've decided that you wanted to go to therapy. Yay! Or you've decided that I have a therapist, but I want to switch. Or you are deciding whether you want to do therapy or not. So I have a couple tips for you to decide how you're going to navigate through this journey. So, all right, I want to see a therapist. Now what? First, where do I even find a therapist? First thing is psychologytoday.com. It is the largest national database that houses all the therapists, psychiatrists, psychologists. I love Psychology Today. So you decide to go on Psychology Today, and it can be a little bit overwhelming. First thing you might want to do to scale it down is possibly use a filter. You can filter it according to gender, race, specialty, insurance. You can filter it to whatever that you want, and that can help you narrow down your choices. With Psychology Today, it's also international, so it's available not just in U.S. but Canada and other countries as well. A second avenue to find a therapist is through your insurance company. If you have insurance, contact your insurance company and say, hey, I have your insurance. I am looking for a therapist. Can you send me a list of the therapists in my area? And usually, your insurance company, if you have a mental health plan, not all insurance plans have a mental health coverage. So, first, you have to make sure that you have mental health coverage. If you do have mental health coverage, what they'll do is that they will send you a list of the therapists. Okay. And that you can also narrow down by age, gender, specialty, what have you. Okay, so you can also try through your insurance company as well, and make sure that you might have a copay or you might not, depending on your plan. The third website that I really like is findpsychologist.org. So that is also another national database where you can go and find a therapist, a psychologist, a psychiatrist, or whatever you have you. Okay. And then you can narrow it down and filter it to whatever you want. So those are three different channels of finding a therapist. Okay. So now let's say you have narrowed your therapist down to three people. And you're like, okay, well, how do I decide who to pick? All right, good question. So I would recommend you call all of the psychiatrists and ask for a consultation. Some therapists will give you a complimentary consultation for like 15, 20 minutes. The consultation is important because it gives you a brief overview of the therapist, and it gives you a snapshot of their therapy style. And it also allows you to tell the therapist what's bringing you to therapy, what's going on with you, right? So that 15, 20 minutes will also get a feel, shopping for a therapist can be like dating, like, okay, I got to figure out, like, do I like you? Let me feel you out. What's going on? So if they offer the consultation, take it. The consultation does not obligate you to that therapist. So just because I talk to a client for 15, 20 minutes, they may decide they don't like me. That's completely fine. Let's say you do the consultation, you're like, aha, I found a therapist that I like. Now what? So, some do's, right? When you first go into the first session, it can be a little bit awkward, like, oh, I don't know, like, I don't know you, like, I'm about to open up to you. Like, I've always been taught, don't put your business out there. Who are you? So there could be some apprehension, with the first session, which is completely normal. Take some deep breaths, meditate, count to 10, whatever you're going to do, and just walk into the therapy session. Keep in mind, it is a confidential visit. Okay. So that therapist is not going to like call your homeboy or homegirl and say, hey, so and so just came in and guess what they talked about. It's supposed to be a private, safe space for you to basically tell the therapist how you're feeling. Now, the first session can feel more of an interview. The first session is what we consider an intake or an evaluation. So it could feel more of like an interview, right? So think about it this way. Let's say you go to the doctor's office, right? And you're seeing the doctor for the first time. The doctor can't treat your problem without knowing what's going on with you and what your background and your history is, right? So if you go into a doctor's office and you have a problem, they're going to ask you, do you have a family history of diabetes, high blood pressure, et cetera, right? They need to get an idea of your background so they can figure out what is the problem that they can treat you for, okay? Any good provider is going to get your history before treatment. So the intake process is going to feel like an interview. It gives the therapist an understanding of, okay, why is this person coming in and what is the plan that we're going to formulate together? So I have a saying that I say to my clients, which is you are in the driver's seat because this is your life. You are going to know your life better than anybody will ever know you. You're going to know your life better than I will ever know you. But as the therapist, as the clinician, I am in the passenger seat, right? Because I am working with you. I'm in the passenger seat. And I also have the GPS, right? The GPS is the license, the credentialing, the training, the professional education, right? That's the GPS. So I'm in the passenger seat and I've got the GPS and we are just navigating this thing to our destination. This is a collaborative effort, right? Okay. So when you go into the intake, take a couple deep breaths. Usually the first session is about 45 minutes to an hour. Okay, now it's done. Can I ask the therapist a question? Yes, you can. Because guess what? Not only is the therapist getting to know you, you are also getting to know the therapist as well. What questions can I ask the therapist? First, can you treat what I'm coming in with? I have panic attacks. Do you treat that? I have social anxiety. Do you treat that? I'm having trouble with my child. Do you treat that? You have to make sure that the therapist that you're going to see treat the issue that you're coming in. Okay, so that is perfectly okay to ask. Do you treat what I'm coming in for? Is this in your realm of expertise? Okay, hopefully a good therapist will be transparent and say, yes, I treat it. No, I don't. There have been times where clients have come to me and say, do you treat the specific issues? And I say, no, I do not. But you know what? I'm going to refer you to a colleague that can treat those issues for you. Any good therapist will, if they cannot treat your issues, will say, no, that is not in my area of expertise, but you know what? Let me refer you out. That is perfectly okay. Not all therapists are experts at everything. So that is perfectly okay. Don't take it personal. Find the next therapist. If you get a consultation with the therapist, that will be a good question to ask. So okay, what else can you ask the therapist? What is your therapy style? All therapists have different therapy styles. No two therapists are the same. So for example, do you give homework, right? You may be a client that you want homework because you want to be held accountable. You may be a client where you don't want homework. You just want to come into the session and talk and leave. That is perfectly fine. Personally, I give my clients homework because it's not just important to talk in therapy, but I need you to do the work outside of therapy, okay? And my job as a clinician is to hold my clients accountable to be their best self. And the only way we're going to get there is if you continue to work on what I recommend after therapy. Some therapists might say, no, I don't give homework, but I give you things to think about, right? I may not give you a paperwork or sheet or anything like that. And that's perfectly fine. You have to decide if that works for you, okay? Another question that you can ask the therapist is, what is your treatment modality? Meaning, what kind of therapy methods do you use in session? So, for example, As a therapist, I use a range of modalities depending on the client that's sitting in front of me. Okay. So my military folks, I notice that they are more solution focused therapy, right? So they want to come in and they want to say, today I have a problem, and today I need your help to come up with the steps on how to solve the problem. Okay, cool. I'm going to use solution focused therapy. That's exactly how it sounds, solution focused therapy. Okay. And then I have some clients that are more into mindfulness. So they want to meditate in session. They want to talk about the here and now, being in the present, gratitude, things like that. That's perfectly fine. I'm trained in that modality. We can do that. So ask a therapist, what is your treatment modality? And see if that's something that works for you. That's important because that also tells you the kind of training that the therapist is specialized in. Okay. Now, I've had a lot of people ask me, can I ask a therapist a personal question? That is a very interesting question. The overall answer is yes. Now, whether the therapist chooses to answer or not, that's up to them. So, for example, you may ask me my age. I may not answer. Actually, I will never answer that. Okay. But I would ask you why you want to know. What makes you want to ask that question? I'm not going to say, why are you asking my age? No. But I'm going to want to know, what makes you want to ask that question? In a sense, clients want to know, can you understand me? I had a client one time that made a reference to a reality show, The Real Housewives. And she said, I feel like I'm like Teresa Giudice. Nobody ever sticks up for me. Long gone are the days where therapists are just dry and uptight or whatever you see on TV. Like therapists nowadays, honestly, I'm a millennial therapist. I'm cool. I'm with it. I watch reality shows. I'm in the know. I'm on social media. So gone are those days where therapists can't really relate to their clients. You're just coming to the session and that's it. Sometimes people might ask the therapist their age because they want to know, if I reference something, will you be able to understand? And I'm like, yeah, I know who Teresa Giudice is, but this is my opinion. Don't come for me, y'all. In my opinion, Teresa Giudice doesn't always have insight onto the stuff that she does to contribute to the drama, but that's for a different time. Anyway, so yeah, I think that you can ask the therapist their age, but guess what? They may choose not to answer. Now, don't get offended if they choose not to answer the question, because therapists sometimes don't want to disclose their personal life, because that might take away from the therapy process, right? Because then we're talking about me when we should be talking about you, right? So you can ask whatever question that you want. Whether the therapist chooses to answer or not, that's up to them. I've had people ask me, oh, do you have a child, or do you have kids, and I find out that the reason why they ask that question is because if I'm talking about my kid, I want to know that you can relate. you know I have my therapist friends that say, I don't need to have a kid to relate to the stress and frustration that you feel about having a kid, because I can help you navigate that stress, right? Like, I don't have to have cancer in order to treat your cancer as a doctor. Another question that you can ask the therapist is, what do you do for self care? I've had clients ask me, I know you're a therapist and you talk to people all day. So, what do you do for self care? That's completely fine. I'm open to tell them I do this, I do this, I do this. And that also shows them I'm not only just telling them, recommending self care to them, I practice what I preach as well. Well, I hope these tips were helpful for you. And I hope that this helps you to further along your journey of either finding a therapist, switching a therapist, and deciding which therapist is the right fit for you. So tell me about your therapy journey. Are you having trouble finding a therapist? Do you absolutely love your therapist? Are you looking to switch, or you just don't even know where to begin? In my next video, I'm going to talk about what does the session look like. So stay tuned and take care. And thank you for visiting. Don't forget to like and subscribe. You guys, I need to grow this channel, so please subscribe and tell your friends to subscribe. Thank you. Take care. Bye.